And I heard about an increased number of deaths from opiates, now exceeding, with prescription opiates, deaths from heroin and cocaine combined. I heard from our Birth Defects Center about more babies being born at risk for congenital heart defects because their mothers had been taking prescription opiates. I learned about more falls among the elderly who were taking prescription opiates, about more drugged driving crashes. And just about the only mortality statistic getting worse is the increase in death from prescription opiate abuse. This is a major public health problem, and it's getting worse and getting worse rapidly.
And this is a sentinel health event. We are awash in opiates. We have not got right the balance between risks and benefits. By all means, for palliation of someone with cancer, we need to treat their pain. But for chronic pain, back pain, headache, you'd be hard-pressed to prove that the benefits of prescription opiates outweigh the risks of what are clearly dangerous drugs. A few doses result in addiction. A few doses too many result in respiratory suppression and death. Over the past 10 years, 145,000 Americans died from overdose from prescription opiates.
The epidemic we have in Ohio is fueled primarily by the pain med problem. We think about at least three-fourths of the people who are on heroin started with pain meds. The same thing would be true with fentanyl and carfentanil. So it's not just the people who are dying in Ohio of overdose of the pain meds. It's what ultimately that leads to. They get them addicted, and then they move on from there. So, you know, this is really cutting at the heart and soul of Ohio.
The Washington, D.C.-based Kaiser Family Foundation published statistics that showed Ohio was the leader in the nation in prescription opioid deaths in 2015. The National Safety Council out of Chicago, Illinois, published an article that states 99% of the doctors prescribe highly addictive opioids longer than CDC recommendations. This comes from the 2016 Ohio ORS annual report. It shows no reduction in opioids dispensed on a per patient per dose review. The top graph shows year 2010, the average prescription was 64 pills. And in 2016, the average prescription was 65 pills. The lower graph is an opioid dose per patient per quarter graph. 2010 shows 147 pills per patient per quarter. 2017 shows 141 doses per patient per quarter.
This has been one of the great mistakes of modern medicine.
Dr. David Kessler, who ran the FDA from 1990 to 1997, doesn't hold back when talking about the explosion in opioid use in the last 2 decades.
Who's to blame? FDA has responsibility, the pharmaceutical companies have responsibility, physicians have responsibility. We didn't see these drugs for what they truly are.